Cervical cancer is one of the most devastating, yet preventable cancers that I can think of. Almost 4,000 women in the United States die from this cancer annually. And so, as always, prevention is key when it comes to a lot of diseases in cancer, and this is at the forefront of options that we have to prevent it so we can further decrease these numbers. What is the cervix, first of all? The bottom part of the uterus, the opening of the uterus, where if there was a pregnancy inside, the cervix is what opens up and lets the pregnancy deliver. We see the cervix kind of like this during an exam or pap smear, but this area is also very susceptible to the HPV virus. And it's where we swab during someone's pap smear or get their cytology to look for these changes from the HPV. Because we know HPV is the main culprit behind all of this. It causes greater than 90% of all the cervical cancers out there. And so HPV, it is transmitted sexually. Now this can be from genital to genital. This can be from hand to genital. This can be from toy to genital. We see HPV in same-sex couples. And so it's not perfectly understood how it happens, but HPV is mainly transmitted sexually, and almost everyone encounters it. We don't consider this an infection like a chlamydia infection or a traditional sexually transmitted infection, but unfortunately almost 90% of people will encounter it in their lifetime. But however, with the help of the immune system, you'll fight it off and it will likely go away and there'll be no consequence. But there are some select situations where it starts to change the cells of the cervix, starts to make them we see precancerous changes, and these things happen very slowly, but we can detect it with things like pap smear. And so here are my top 4 ways that we can reduce your chances or prevent cervical cancer. Number 1, the HPV vaccine. It's a very safe, proven vaccine, and I don't think with this video I'm going to convince anybody whether they trust vaccines or not, but this vaccine has a proven safety profile and is given to young men and women. So yes, young men should be potentially offered this vaccine to prevent transmission later on, because it can cause cancers in men, however less frequently than in women, but it can affect the throat, it can affect penile or anal cancers, and so it's good for young men also, and also to decrease transmission to young women. HPV vaccine is number 1. You might have heard of Gardasil. It prevents against a number of strains, mainly the bad strains. We're talking 16, we're talking 18, we're talking 45. Okay, it's not all of the strains. I mean, there's potentially hundreds of HPV strains, potentially dozens of high-risk ones, and then this really prevents the super bad ones that we know that are associated with developing or a higher risk of developing cervical cancer. Number 2 is getting the pap smear done, or what we call a cytology. It's the brushing of the cervix cells, so we can look at under a microscope and say, do these look normal or not normal? When they look normal, great. Often people get a pap smear every 3 years in their 20s, and then in their 30s every 5 years with the HPV testing. But if there is abnormal, this can be a range of abnormal from, we call it ascus, or undetermined significance. They're not quite sure if they're normal, it's reactive changes, or is it changes from the HPV, and so we call that ascus. And it's kind of like a low grade, but we want to watch it closely. And so then there's low grade, which the body often resolves these low grade changes like 90% of the time with a healthy immune system. Stay tuned we'll talk about the immune system in just a second, but healthy immune system often reverts these low grade changes back to normal like 90% of the time. However, sometimes, depending again on age group, we might want to take a closer look at these low grade changes. We've learned over the years that we should really have a higher threshold for doing interventions for these low grade changes because of the high chances of resolving with your own immune system. And then there's high grade changes, which at this point, we have a higher chance that this progresses on to precancerous, cancerous changes. We really want to take a close look at these and potentially do other interventions to decrease the chances of those cells turning abnormal. This is potentially one of the biggest things you can change as far as your prevention of cervical cancer is to stop smoking. Now, I know the numbers of people smoking is much less, but smoking decreases the immune system, increases the pro-inflammatory state of the body where things like cancers develop. It doubles your risk of developing cervical cancer. And so that hopefully goes without being said, or other reasons cause you to stop smoking, but if you haven't, this is a major one. This goes along with also taking care of your body, decreasing other things that would decrease the immune system. Alcohol, other drugs, not having a good, well-rounded diet, healthy diet, exercise, all of those things, good diet, exercise routine, things like that are going to decrease your chances of developing these changes that could lead to cervical cancer. And the last point is follow up with your doctor. Now, I understand for a lot of people it is very difficult to get in and to get the pap smear done, whether it's difficulty with the exam, life is busy, but often for cervical cancer, most of the time, it's not people who are getting their routine screening and getting their checkups if abnormalities are happening. It's people that are lost to our care for 5 years, 10 years, 20 years, and then something goes undetected. It's pretty rare that someone develops a cervical cancer if they're coming to see us at the clinic when the guidelines recommend. And so I hope that helps. Again, this is our first video in the 30 videos in 30 days. So please like the video, follow along, and there's a fundraiser link down below. So if someone gets value from this video, you could maybe make a small donation, because we're trying to fund women's cancer research, because we can't depend on the government right now for helping progress further prevention and treatment of gynecologic cancers. And so I've selected a GoFundMe below. Please consider contributing to the fundraiser. We'll talk to you soon, actually tomorrow, for our next topic.